Hello everyone, my name is Dr. Samara White. I'm a pharmacy resident here at Buffalo Psychiatric Center, and today we'll be talking about bipolar disorder. We're going to discuss what bipolar disorder is and what the different types are. We'll talk about medications and then some other strategies in addition to the medications. So what is bipolar disorder? Bipolar disorder is a mood disorder where there's periods of extreme sadness or depression followed by periods of extreme elevated mood or mania. Most people experience changes in their mood, but the difference is in bipolar disorder, that range of moods is much greater than normal. So the highs are really high and the lows are really low. Here are some of the depressive symptoms that people with bipolar disorder experience during those low periods. Low mood, loss of interest, trouble sleeping, decreased energy, feeling worthless or guilty, inability to concentrate, or thoughts of suicide. The high periods are called mania, or having a manic episode. This is a period of abnormal and persistently elevated, expansive, or irritable mood. So you'll see things such as having a lot more energy or being more active. Some people can be very agitated, irritable, or be easily distracted. People will often have trouble sleeping or speak very fast with many different topics. And a very common experience is engaging in many high-risk activities, such as gambling, drugs, or having sex. And in mania, there's usually delusions or hallucinations present, which may require hospitalization. And then there's hypomania, which is a less extreme mania. The same symptoms that we discussed on the last slide will still be present, but to a lesser degree, and they last for about 4 or more days. These symptoms will be observable to others, but not necessarily to the person experiencing it. And there's usually no delusions or hallucinations, therefore it usually doesn't require hospitalization. Here is a good visualization of what we just discussed. So a person without bipolar disorder will have these normal variations in their mood, whereas a person with bipolar disorder will have these drastic highs and these drastic lows. The highs are called mania and the lows are called depression. And then as we discussed, hypomania is just a little bit lower than mania, but it is still relatively pretty high. Next, we're going to talk about some different types of bipolar disorder. The main two that you may have heard of are bipolar 1 and bipolar 2. The difference between them is that in bipolar 1, the moods alternate between mania and depression, whereas in bipolar 2, the moods alternate between hypomania and depression. Our next type is called cyclothymic disorder, or cyclothymia. This is basically a more mild presentation of bipolar disorder. So the depression is not as severe and the hypomania is not as severe. The last type we'll discuss is called rapid cycling bipolar disorder. This is when the moods switch between depression and mania at least 4 times or more per year. Next, let's watch a quick video to summarize everything that we've discussed so far.
Maybe you've heard the term bipolar used to describe someone who's moody, or who has mood swings. But this colloquial use of the term is really different from bipolar disorder. Bipolar disorder, which used to be called manic depression, is a serious mental illness that causes a person to have dramatic shifts in emotions, mood, and energy levels, moving from extreme lows to extreme highs. But these shifts don't happen moment to moment. They usually happen over several days or weeks. There are a few different types of bipolar disorders, but there are some common features. First, the low moods are identical to those in a related disorder, major depressive disorder, also known as unipolar depression. Individuals with this can feel hopeless and discouraged, lack energy and mental focus, and can have physical symptoms like eating and sleeping too much or too little. But along with these lows, the thing that sets bipolar disorders apart from unipolar depression is that individuals can have periods of high moods, which are called manic episodes or hypomanic episodes, depending on their level of severity. In a manic state, people can feel energetic, overly happy or optimistic, even euphoric with really high self-esteem. And on the surface, these might seem like really positive characteristics, but when someone's in a full manic episode, these symptoms can reach a dangerous extreme. A person experiencing mania might invest all of their money in a risky business venture, or they might behave recklessly. Individuals might have pressured speech, where they talk constantly at a rapid-fire pace, or they might have racing thoughts and might feel wired, as if they don't need sleep. Manic episodes can also include delusions of grandeur, like for example, they might believe that they're on a personal mission from God, or that they have some supernatural power. And finally, they might make poor decisions without any regard for later consequences. One way to understand these swings is by charting them on a graph. So let's say that the y-axis is mood, with mania and depression being on the far ends of the axis, and the x-axis is time. The average healthy individual might have normal ups and downs throughout their life, and they might even have some pretty serious lows once in a while, maybe after losing a job or moving to a new place and feeling lonely. An individual with unipolar depression, though, might have normal highs, but they'll probably also have some crushing lows that last for a long period of time and might not even have an obvious trigger. Now, for the bipolar disorders, the first one is called bipolar 1, and these are people that have some major lows that last at least 2 weeks, and then some major highs that last at least a week or require hospitalization. That said, untreated manic episodes can last as long as 3 to 6 months. And even though depression is seen in most cases, it's not actually required for a diagnosis. The second one is called bipolar 2, and this is when a person experiences similar lows and has additional highs called hypomania, which are less severe manic episodes than we see in bipolar 1. To qualify for a diagnosis, these hypomanic states need to last for at least 4 days. Once again, though, these symptoms generally last a few weeks to a few months. Alright, and the third one's called cyclothymia, or sometimes cyclothymic disorder. And these people have milder lows as well as milder highs, or hypomania like you see in bipolar 2. And they cycle back and forth between these two over a period lasting at least 2 years. Sometimes people with bipolar disorder can show other, less common symptoms as well. For example, having what are referred to as mixed episodes, experiencing symptoms of both depression and mania at the same time. Another symptom they might have is rapid cycling, which describes a situation where a person has 4 or more episodes of depression or mania within a given year. Like most mental health conditions, the exact underlying cause of bipolar disorder isn't known, and there's no single bipolar gene that's been identified, but it's thought that there are genetic and environmental factors that play a part. For example, one interesting clue is that people with family members who have bipolar disorders are 10 times more likely to have it themselves. Another clue is that some drugs and medications can trigger manic episodes, like selective serotonin reuptake inhibitors, or SSRIs. It's also worth mentioning that people with bipolar disorder often have other disorders like anxiety disorders, substance abuse disorders, ADHD, and personality disorders as well, making diagnosis and treatment a real challenge. Even though there's no cure for bipolar disorder, identifying and treating individuals is really important, since there's a real danger that the person could harm themselves or even commit suicide. One of the oldest treatments is also one of the most effective treatments, and that's lithium salts. Lithium acts as a mood stabilizer, smoothing out the highs and the lows that they experience. That said, it's much better at treating manic rather than depressive episodes, and so individuals who take it often have to take other medications as well, which can be problematic since some antidepressants, like SSRIs, can trigger manic episodes in people that are predisposed to them. Other treatment options include antipsychotics, anticonvulsants, and benzodiazepines, but many of these, including lithium, have side effects that can be severe and lead to non-adherence, which can be dangerous for the person. Now, unlike certain disorders like unipolar depression, psychological interventions like talk therapy or cognitive behavioral therapy are not particularly effective in treating the manic episodes of bipolar disorder. Having said that, they can still be very helpful tools to help someone with bipolar disorder in general, especially after a manic episode has ended. They can also help the person handle stressful situations that might otherwise lead to a manic episode. thereby helping to prevent a potential manic episode in the first place. Alright, so super fast recap. Bipolar disorder is a mental disorder characterized by depression, periods of lowered mood, as well as mania, periods of a heightened mood.
We're going to talk about medications next, but first let's watch a quick video. The first medication we'll discuss is called lithium. Lithium has a complicated and still relatively unknown mechanism of action, but it's really helpful for mania. Patients who are on lithium must have their blood levels checked every so often to make sure that they're at an appropriate dose and that the level is safe and not too high, because if it's too high, it can cause some bad side effects. General side effects of lithium include nausea, tremor, excessive thirst and urination, acne, and weight gain. Some things that can increase lithium levels are NSAIDs like ibuprofen, some heart medications such as ACE inhibitors, ARBs, and some diuretics, decreased kidney function, and low sodium levels. So we want to be careful of these because these can make the level too high and cause those bad side effects. Next, we have valproic acid. Valproic acid is also known as divalproex or Depakote. Valproic acid has a couple of different formulations, such as oral tablets and capsules, even an oral liquid and sprinkle capsules. Like lithium, it also has a complicated mechanism of action. And also like lithium, patients who are on valproic acid must also get their blood levels checked, and this is to make sure that they're on a good dose. Something very important to know is that women of childbearing age should be on birth control while taking valproic acid, and this is because it can cause some birth defects. And lastly, some general side effects are nausea, tremor, alopecia, weight gain, and sleepiness. There's not too much to know about lamotrigine, also called Lamictal, but you should know that it's not used for mania, it's only used for bipolar depression. Some general side effects are headache and a slight trouble thinking clearly. And the most important thing to know is that you should let your physician know as soon as possible if you develop a rash. This rash is very rare, but it can be very dangerous if it appears. And for this reason, we typically start lamotrigine at low doses and increase it slowly. So this is why it's so important to always take lamotrigine just as your doctor instructs you to. Antipsychotics are often used in bipolar disorder, and it's mainly because they start working quicker than mood stabilizers. And also, some of them are available in long-acting injectable form. Some example antipsychotics are aripiprazole, also known as Abilify, lurasidone, also known as Latuda, olanzapine, also known as Zyprexa, quetiapine, also known as Seroquel, and risperidone, also known as Risperdal. And finally, antidepressants are sometimes a very important component of treating bipolar disorder, because as we discussed before, bipolar disorder can cause some very low moods. People who have bipolar disorder should never take antidepressants without a mood stabilizer, because this can switch them into a manic phase. And this is why some people who are unaware they have bipolar disorder, if they take an antidepressant, it switches them into mania.
Bipolar disorder, also known as manic depression, is a mental health disorder characterized by a swinging variation in mood. Sufferers experience both episodes of elation and depression. The condition may significantly impact an individual's ability to function, frequently causing detrimental effects on home, school, and work life. Amongst the worst cases, episodes of self-harm or suicide may be present. Up to 20% with bipolar disorder successfully commit suicide, an unacceptably high number. Therefore, improving our understanding of this mental health condition is imperative to help us identify the warning signs in ourselves and our loved ones. So want to learn more about bipolar disorder? Keep watching as we'll break it down here. So let's talk about mental health. My name is Dr. Hart Pinto, and in this series we aim to break down the social barriers to mental health. At JHP Medical, we make weekly information videos designed to increase awareness and help you better understand your medical condition. So if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. Okay, so what is bipolar disorder? Bipolar disorder, previously known as manic depression, belongs to a group of mental health conditions known as mood disorders. This condition gains its name from patients' swinging polarities in mood, ranging from elation to depression. The term bipolar literally means the two opposites. Some consider the symptoms of bipolar disorder to be amongst the most severe and persistent among psychiatric illnesses. The condition can have a significant impact on individuals' social and family life. Suicidal thoughts and attempts can emerge in the most severely affected. So who gets bipolar disorder? Approximately 1 in 100 people will be diagnosed with bipolar disorder at some point in their life, suggesting this condition is relatively common. The condition equally affects men and women, usually presenting in the late teens to early 20s. The condition may affect people from all ethnicities and all walks of life. Why exactly bipolar disorder occurs is not fully understood. However, we think the condition is related to abnormalities in the brain's biochemistry. Bipolar disorders tend to run in families, suggesting also the presence of a genetic link. However, no single gene is responsible for the condition, and a complex interplay of genetic and environmental factors is likely. There are, however, several factors that can trigger episodes of bipolar disorder, including stressful life events, poor sleep, and physical illness. What do people with bipolar disorder experience? People with bipolar disorder experience fluctuations in their mood, from elation to depression. Symptoms of bipolar disorder will therefore depend on which mood you are currently experiencing. So let's look at the symptoms of elation, known as mania or manic episodes. Whilst everyone will naturally experience periods of elation in their life, like when exposed to happy events, manic episodes are different. During manic episodes, individuals experience feelings of being very high and overreactive. Symptoms are persistent and often out of context with current events. Individuals may express rapid changes in mood, from highs to irritability or even anger. We can break down episodes dependent on severity into two distinct groups: hypomania and mania. Hypomania is characterized by greater than 3-day history of persisting mild elevation in mood. Individuals feel more energetic and show an increased level of activity. A resulting knock-on effect on their sleep patterns may occur as individuals experience a reduced sensation of tiredness or the need to rest. Individuals during this phase are usually more talkative, they may be overfamiliar, and may demonstrate an increased sex drive. Now let's look at mania. The definition of mania includes a greater than 1 week of mood elation or increased irritability. In manic episodes, there is a significant impact on day-to-day life. Again, patients demonstrate increased levels of energy associated with a significant reduction in sleep and the potential for exhaustion. An increase in sexual disinhibition causes sexually explicit behaviour, including flirtation, inappropriate touching, or sexual propositioning. Individuals may go on to experience psychotic symptoms including auditory hallucinations. Individuals may experience the feeling of increased creativity and intelligence. Common delusions include the presence of superhuman powers, a requirement to complete a mission, or the belief they have great wealth. This can lead individuals to go on large spending sprees, which can lead to considerable debts. During episodes of elation, individuals may dress inappropriately, frequently in bright or even outlandish colours. There may be a noticeable deterioration in personal hygiene also at this time. Generally, an individual's insight into the episodes of mood elation are usually poor. Separate episodes of depression will also occur. Individuals will display the same symptoms as those experiencing clinical depression. Depression also can have dramatic implications on day-to-day life. Doctors characterise depression as pervasive, unshakable low mood, plus a reduced interest in normal activities. We have taken a detailed look at the symptoms of depression in a previous video. If you want to learn more, I will provide a link in the description below. How will my doctor diagnose my bipolar disorder? Bipolar disorder can be one of the trickier psychiatric conditions to diagnose, given the vast variation in symptoms patients can have on their initial presentation. However, your GP or primary care physician will suspect bipolar disorder where you demonstrate a mixture of symptoms, including hypomania, mania, and depression. Symptoms must have been present for at least 2 weeks. To confirm the diagnosis of bipolar disorder, your doctor will request a review by a specialist in mental health, and they will want to review your prior medical history and any other psychiatric conditions and medications you may be taking. Additionally, your doctor will want to rule out any undiagnosed physical illness, including thyroid disorders, and therefore is likely to request additional blood tests. So what about treatment? The recommendation for treatment will vary based on the nature of the episode you're experiencing. As always, the best treatment includes a shared decision making between you and your doctor. During acute episodes of mania, most patients will require inpatient hospital admission under specialist psychiatric care. For many cases, hospital admission is compulsory due to the potential risk of harm patients pose to themselves or others. During acute episodes, specialists prescribe a trial of benzodiazepines or antipsychotic medications. These medications aim to quickly regain control of your symptoms. If you develop symptoms of mania whilst taking antidepressants, your psychiatrist will stop this medication. Antidepressants could potentially worsen any manic episodes. If your mania symptoms remain poorly controlled, a second antipsychotic medication or lithium, a mood stabilizer, can be taken. Following the resolution of your acute manic episode, your psychiatrist may offer long-term lithium. Lithium is an effective mood stabilizer that aims to prevent any further relapses. After commencing lithium, you will require regular monitoring. Lithium levels are measured via a blood test 1 week after starting treatment and weekly until the levels are stable. Once your specialist is happy with your level, monitoring is required only every 3 months. Additionally, every 6 months, your body mass index, blood salts, and calcium levels, kidney function, and thyroid function will be checked. Whilst lithium is an excellent mood stabilizer, this medication may not be effective in everyone. Some will require an addition of a second medication such as sodium valproate. For patients unable to tolerate lithium, an alternative combination therapy with sodium valproate plus an antipsychotic medication is available. The management of depressive episodes in bipolar patients is usually in the form of quetiapine or fluoxetine combined with olanzapine. Additionally, psychotherapies can also prove beneficial in the management of depressive symptoms. So what about prognosis? Unfortunately, no cure exists for bipolar disorder. The natural history of the condition means relapse is likely, with individuals expected to experience an average of 10 episodes in their lifetime. The chance of recurrence within 12 months of the initial episode is around 50%. However, most relapses are associated with poor medication compliance. I hope you've enjoyed this video. Don't forget to subscribe and interact by giving us a thumbs up or leaving a comment down below. This supports the growth of our channel and helps educate many more people about their medical conditions. Of course, this video does not provide individual medical advice and is intended for information purposes only. Do not consider this as a substitute for professional medical advice, diagnosis, or treatment. Please do not ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time.
Let's wrap up with some review questions. Our first question is, hypomania is a feature of which of the following? A. Rapid cycling bipolar disorder. B. Cyclothymia or cyclothymic disorder. C. Bipolar 1 or D. Bipolar 2. The correct answer is D. Bipolar 2. Our next question is, why shouldn't someone with bipolar disorder take an antidepressant without a mood stabilizer? A. The antidepressant won't work. B. The antidepressant is unnecessary. C. It can cause a switch into depression. Or D. It can cause a switch into mania. The correct answer is D. It can cause a switch into mania. Which medication has the side effect of a rare but serious rash? A. Lithium. B. Valproic acid. C. Lamotrigine. Or D. Divalproex. The correct answer is C. Lamotrigine. Which two medications require blood draws to check serum levels? A. Lithium and lamotrigine. B. Lithium and valproic acid. C. Lamotrigine and valproic acid. Or D. Lamotrigine and antipsychotics. The correct answer is B. Lithium and valproic acid. Thank you for learning about bipolar disorder with me. I hope you have a great day.